Okay, so I had a little bit of coffee, and I think that helped kind of warm things up, get things a little lubricated, so I can talk a little bit better. I just want to make this vlog to give people kind of some general expectations of what to expect with vocal feminization surgery. So I'm currently at day 14, so it's been 2 weeks since surgery. I had that with Dr. Mardirossian up in Virginia, and it was a really great experience. But as of this morning, it feels like I'm learning how to talk again. But I'm just gonna have some coffee here again. So I'm gonna switch to whispering, which will probably be a little more understandable. So if I'm whispering, you can probably understand me a lot better now. It's a lot easier to kind of formal my speech that I'm used to doing. But generally, I like to get out of just having to whisper. Yeah, this has been like one of the hardest recoveries I've ever gone through, and it's not something to take lightly if you're a trans girl looking to kind of get a hold on your voice and have it be in a more manageable place for you. I'm still pretty optimistic and excited for this though, so we're only at day 14, so I'm thinking in another week or two, probably gonna be hopefully a lot further along in terms of just sounding less strained and hoarse. But that is also gonna come along with following the post-surgical instructions, such as, only talk for a short period of time, every hour, give yourself adequate vocal rest, hydration, and just take it easy. You're still recovering from surgery. Any surgery is pretty impactful on the body, and I was intubated and everything, so my whole throat's kind of honestly kind of ravaged from the whole thing, but it's definitely getting better. There's no pain right now, I'm really happy to say. I was having all kinds of weird aches and pains and dull and sometimes like sharp dry pains, and for the whole 2 weeks going up to this day, like, you're gonna think, oh god, did I break my sutures, did I pop something? But most likely, unless you're like really trying and having extremely like strong coughs and sneezes, I doubt you're really gonna do much damage. If you're taking it easy, you're not bending over and lifting a bunch of stuff and straining, the Valsalva maneuver and all that where you bear down. If you're not doing all that stuff, you should be pretty good. But I think most of my pain came from inadequate humidifying of the air. So it took me till like probably day 2 or 3 of post-surgery to get an adequate humidifier. And once I did that, things got a lot better. I definitely recommend get a humidifier as soon as you can, and preferably have it before you go in for surgery, so that when you go back to your hotel room or wherever you're recovering, have that stuff ready to go. I did get a Halls one and some other brand, I forget what it is. I got 2 because I was just like, let's just see which works. I was in pain and desperate. I was like, I'm getting 2. One of these is gonna work. So now I just have them in different rooms now that I'm back in Florida. But I'd say for the Halls one, don't get the menthol or any of the scent packs, because any sort of irritation reflexive ones that you can't really get out of. You just kind of have to manage it and kind of hold it down. So again, with that kind of thing, definitely you want humidification. I'm gonna get another drink of my coffee here. But it's first thing in the morning. My voice is pretty raspy still. So no miracles yet, but you know, it's a marathon. It's a long healing process, and the surgeon, they informed me we're not going to be doing before and after recordings until 6 months out, which is going to be a lot more representative of what you're going to be looking forward to in the future. So it's going to take a long time for all of that tissue in there to really heal, and for you to get all that muscle memory and everything back and learn how to talk. It's a long process. And I set myself up for quite a challenge here because I'm starting my new nursing residency program this coming May. So I've got about 2 weeks of getting my voice kind of up to speed, and it'll be a challenge, and I'm up for it. I'm gonna do what I have to do. I guess the worst case scenario is I have a slow recovery, which, you know, this is entirely possible, and I'm not writing that off. I did have a lot of coughing due to being in Virginia and West Virginia with the dry climate. It made it really difficult. So my first week was very irritating for my throat. But that's pretty standard in general. I think I just made it worse by not having as humidified as a climate as I'm used to with Florida, where out here it's like upper 60s, like ambient humidity, whereas in West Virginia it was like 30s, maybe 40% outside if it was raining. So definitely you want to make sure you get your humidification in order beforehand. So I guess what I'm saying is it's a long road for recovery. Anyone who gets into this, definitely have some buffer time before you go back to work. And like I was saying, worst case scenario, sorry I got off track. I might just have to whisper like this. I might just have to whisper and say everything in more of this quiet tone, which, you know, whispering isn't great for your vocal folds as well. So I'm going to try to minimize this just as well. But worst case scenario, I'm just going to whisper for a bit if I really need to communicate more clearly with someone. And being a nurse, when you have to do, you know, communication with your patients and sort of education, or help them out understanding their meds, or what their, you know, plan of recovery is going to be like after they talk with their doctor and everything, you're going to have to reiterate some of the patient education. As a nurse, that's part of your job. So there's a lot of communication. I'm up for the task. I'm going to do what I have to do. But, you know, really excited otherwise. Super happy I did this regardless. You're going to have a lot of anxiety and fear that, like, in the first, like, few days of, like, oh God, I can't talk. This is really frustrating. And it is. The most frustrating thing is just being locked in. So, definitely know, like, if you went through with this, it's a done deal. You did it. Come to peace with it. I'm super happy I did it still. I was not happy with my voice beforehand. So, if I just have to whisper for a while and have a hoarse voice, that's a win in my book. Huge win. Because dysphoria with your voice, it's really hard to explain, but it's just like every time you talk, you get misgendered. I was getting correctly gendered, I'd say probably 80% of the time, which for me is pretty good. I was happy with that 80% of the time. And transition is a long process. So getting to 80 was really good, but it was really demotivating and painful when you open your mouth and then all that effort and progress you felt towards your transition was it felt undermined. And yeah, you get clocked immediately when you start talking. Even with your best voice, sometimes it's hard. And for me, the decision to get the surgery was based a lot on just this real inability for me to keep my voice feminine 24/7. Now, granted, this surgery is not going to feminize your voice. It is not going to make you sound clockable as a woman. This surgery is more about compressing your vocal range and raising your lower limits so that you can't go quite so low anymore. Which having a I guess higher fundamental frequency, it is kind of a benefit to trans women, and that's why we get this surgery, is so that we can not have to always rely on muscle memory to raise our larynx and do all this fancy voice modification stuff that we do, just kind of DIY and through speech therapy. For some of us, that's really hard to do all the time. And if you cough or if you eat, swallow, a lot of times it just reflexively brings it down, and that was a huge problem for me. I'd be, having a meal with friends, and I'd be in the middle of eating, and someone would say a joke, I'd laugh, and it would be real low, like, Now, you're gonna notice some of my vocal tones are kind of low still, and my understanding is this is an artifact of a lot of the swelling still, and just general inflammation and healing process. So you can expect some low tones in the beginning as well. So don't think you're gonna be sounding perfect like some of these people on YouTube, like 2 weeks out. Some people are just like model patients for recovery. Some people are built different, I'm sorry. But most people, I'm guessing, myself included, this is a marathon, and I hope you are equipped with plenty of water, time, and endurance, especially mental endurance. Communication is going to be harder, and chiefly it has been frustrating. So that can be a strain for you and the people you communicate with in your life. I have had to be using an iPad with the Magic Keyboard, and I would recommend that greatly. So definitely get yourself a laptop or an iPad with a keyboard, and be using that. Sorry, I'm getting out of frame here. I'm still learning this camera here. I really like it though. Get good at typing. That would be my best bit of advice for you. Learn a little sign language, learn thank you and sorry and a few things. Share that with your family, and then get a computer so that you can type and do text to speech. I can show later in another video what I used, but that is going to be your biggest tool to bring that iPad, keep it charged with you so that you can communicate. I've been able to do phone calls and everything with it just by using speaker mode on my phone. So do that. If you don't have that with you, you are just making your life hard. Don't do that. By the way, I'm just hanging out at Costco here in the parking lot early in the morning because it was insanely busy at the gas station, and as a trans girl, I have social anxiety. I don't want to be out there with a million people watching me talk to myself like a crazy person. But I'm super excited for the results of this surgery. I right now am starting to get the feel for my new voice, and I want to share that process with y'all. That's the main goal right now, is to share it. Answer any questions if anybody has any. Yeah, being a trans girl is real hard, and if I can help any of y'all, just let me know. Reach out, and I'll try to message you back. But if anybody does get to see this video or finds any use out of it, just let me know. I appreciate you all, and hope you all have a great day.